Lirandzu Themba takes a look at some of their projects.
Women are in the driver's seat at the CSIR in changing the face of primary healthcare. Many motorists have been subjected to a breathalyser to test for alcohol levels. Now researcher Valentine Sasa is using the same technology to detect and monitor diabetes.
The pricking method is quite painful, so if you you have to prick at least 3 times a day. So if you prick 3 times a day, maybe in a month, you can develop finger swell. Sometimes you lose your fingerprint. So, and then when you have finger swell, you can have like other infectious diseases.
It's a cost-effective method, as a diabetes detecting breath analyzer can last up to 5 years.
This is cheaper for South Africans because it's a once-off kind of a purchase, like unlike the current one where you have to buy the strips, which cost about 200 rands, and then they can only last you for 20 days.
The CSIR is also attempting to redesigning drugs to suit Africans. Currently, drug companies are conducting clinical trials on Western stem cells, which can be problematic when administered to African users.
We think that as many as 1 in 12 people are going into hospitals in South Africa not because they're sick from the disease, but because they're sick because the drugs are not tailored to work with their genetic mutations. So we, as a country, need to come up with an inexpensive model so that we can retest these drugs.
Women are also spearheading research into how medicine can enhance food security, starting with one chicken at a time.
Probiotics helps the host digest its food better, so then you get a higher average daily gain. So it grows better, faster, without chemical intervention or without almost a booster shot. And then because it's a biological solution, it lowers your mortality rate, and you also have an increased resistance to disease in the broiler house.
And the all-female team has some sage advice for those who believe cosmetic skin products will make them look younger.
With cosmetics, it's not possible, really. To be honest, it is not. Because as much as we can claim looking younger, it's only when you use. The minute you stop using, the condition comes back.
The CSIR is also working on safety and development of skin care products with scientifically tested health benefits for healthy skin. Lirandzu Themba, Pretoria.